It's estimated between 6 and 7,000 households were displaced in the Camp Fire. 1 year later, the public health burden on these people and on the whole region is still significant. As many people camped out or stayed in nearby communities, they pushed the traffic and sewage infrastructure in those towns to the limit. Dr. Andy Miller says Chico, the next town over, suddenly gained 45,000 people.
In Chico, the amount of sewage went up about 1 million gallons overnight, which is 15 years of growth.
Within 6 months of the fire, many had moved on. Now Chico's extra population is closer to 19,000, but other health infrastructure is still stretched thin. A hospital was among the nearly 19,000 buildings destroyed. California's Governor Gavin Newsom signed a bill to allow a standalone emergency room in Paradise. These are typically illegal in the state of California, but the situation in Paradise is far from typical. Dr. Miller told Newsy the remaining area hospitals are operating with 40% more patients than usual.
Even though Paradise was only about 10% of the county's population, it had about 25% of the skilled nursing facility beds and almost half of what are called intermediate care beds. The loss of that infrastructure really is affecting our existing hospitals. When they have people that are well enough to leave the hospital, they may not have a place to go.
Crews have been cleaning up Paradise all year, but the burn scar still carries physical health risks. Miller says empty pools and tanks are breeding grounds for mosquitoes, which has helped make West Nile virus activity widespread throughout Butte County this summer. And officials still don't know how severe toxic exposure has been in the area over the last year. They've found heavy metals like lead and mercury and chemicals like benzene, probably from melted plastic pipes. Short-term exposure can cause eye and skin irritation, and the CDC warns prolonged exposure can cause cancer.
A large fraction of the fuel that is burning is not biomass, but rather consumer products, construction materials, cars, paints. And so now this changes the emissions landscape dramatically.
Air quality researcher Keith Bynes says the risks from emissions aren't isolated to the burn scar area either. For 11 days following the Camp Fire, he says he recorded pollution levels in the Bay Area 100 times higher than normal. These were levels of toxicity never before seen in the U.S.
Typically when you go and you analyze something, you're looking for something specific. I'm looking for molecule A and I'm looking for molecule B. There's another type of analysis where you go in and just show me everything you can. And you try to find out, given these signatures, what's in there. Out of about 2,000 compounds, there was a very, very small fraction that we could actually identify, that we actually knew what they were.
The community leaders trying to help everyone else are feeling the strain themselves, too. Dr. Miller with the Public Health Department says some staff never returned to work after the fire. Officials estimate it will take between 10 and 30 years to get public health restored to its pre-fire status. County officials say it will be a learning experience, not just for this community, but for other cities across the U.S. that face their own disaster risks.
Nobody wants this to happen, and unfortunately it has happened. One of the possibilities is to rebuild a city that is better than it was before.